My name is Bradley Fritz. I'm an assistant professor at Washington University in St. Louis, and my research group is working toward the goal of using a machine learning-based early warning system to help prevent complications and deaths after surgery. This is an important goal because every year, 4 million patients worldwide die within 30 days after surgery, which is similar to 8,000 fully loaded commercial airplanes crashing. Many deaths may be attributed to failure to rescue, suggesting that improved risk recognition can improve patient outcomes. To work toward this goal, I have led a multidisciplinary team in training and validating models that predict postoperative death, acute kidney injury, respiratory failure, and several other complications with excellent discrimination and calibration. We have also solicited input from anesthesiologists and other key stakeholders to learn how machine learning models can best integrate with existing perioperative workflows. Finally, we are halfway through a 5,000 patient randomized study testing whether real-time access to our machine learning predictions improves the accuracy of risk estimation by anesthesia clinicians. The next step toward achieving our goal, which will be the subject of our next grant application, is to test whether changes in patient management guided by our machine learning predictions can prevent postoperative complications.
One thing I don't need to explain to any anesthesiologist is how cool it would be if we could reverse anesthesia. My name is Railey White, and I'm an anesthesiologist and a chemist. During my postdoctoral training, I studied a propofol analog that was not sedating and was remarkably able to reverse propofol anesthesia in zebrafish. I'm now on faculty at the University of Pennsylvania, and I'm using my training in basic science to develop propofol reversal agents. I'm currently working to move these findings from zebrafish to a mouse model, and I'm also using medicinal chemistry to explore additional non-anesthetic molecules that are also antagonists. I'm testing various hypotheses about how specific structural elements of these molecules correlate to their biologic function. This may lead to both an exceptionally useful addition to our anesthesia therapeutic armamentarium in the form of a clinically useful reversal agent, but will also create valuable tools to further investigate potential mechanisms of this anesthetic antagonism. Perhaps someday this will change how we practice anesthesia. Wish me luck, and thank you, FAER, for your support.
My name is Dr. Jacob Basak, and I'm an assistant professor in the Department of Anesthesiology at the University of Colorado School of Medicine. I also subspecialize in critical care medicine, and am currently working in a lab that is trying to understand some of the mechanisms that are at play and dictate the cognitive changes that occur after an acute brain injury. Many of us have probably interacted with patients, possibly family members or friends, that have been afflicted with an acute ischemic stroke. And we know they go on to struggle with motor deficits, sensory perception difficulties, and also speech changes. However, one thing that is also not as readily apparent to the observer, but can be very frustrating for these individuals, is they can have cognitive changes after a stroke, including issues with thought processing and memory formation. Our lab is trying to understand the molecular pathways that may be targeted in stroke survivors to improve cognition. Specifically, in my project, I'm looking at how the pathophysiology of neurodegeneration may be playing a role potentially in post-stroke cognitive impairment. I've specifically found that the amyloid beta peptide, which is increased in the brains of Alzheimer's patients, is also upregulated in the brains of animals that survive an acute ischemic stroke. So the long-term goal of my project is to better understand the relevance of the amyloid beta peptide increases after a stroke, and potentially to see if we can repurpose some of the Alzheimer's disease therapeutics that have been developed targeting the amyloid beta peptide as a way of potentially treating post-stroke cognitive impairment in the survivors of a stroke.
Hi, I'm Marie-Louise Meng, and I'm a cardiothoracic and obstetric anesthesiologist at Duke University in North Carolina. One of the biggest healthcare issues in the United States right now is the high rate of maternal morbidity and mortality compared to other high-income nations. Cardiovascular disease is a leading cause of that maternal morbidity and mortality. Women in America are entering pregnancy at older ages and with more cardiovascular risk factors such as diabetes, hypertension, and obesity. Preeclampsia is a dangerous pregnancy complication that affects 2 to 8% of pregnancies and is a strong independent risk factor for short and long-term cardiovascular disease. My goal is to bridge the gap between cardiology and obstetrics and to investigate maternal cardiac disease, preeclampsia, and the short and long-term cardiovascular effects of preeclampsia. Currently, there is no way to predict which women with preeclampsia are at highest risk of developing an adverse cardiac event. Using the support from the FAER Mentored Research Training Grant, I will develop and validate a risk score to predict which women with preeclampsia will go on to develop cardiovascular complications. The score will be created and validated using the Premier Healthcare Database, which is a nationwide administrative database that represents almost a quarter of all of U.S. in-hospital births. I will validate and expand the risk score in the North Carolina population using a combined data set from Duke and UNC. Improved cardiovascular risk prediction is essential in preventing cardiovascular disease later in life after pregnancies complicated by preeclampsia. I am grateful for this opportunity to contribute to the field of maternal cardiovascular health.